rapid access to comprehensive oncology data and survival analysis. This is the Onco Toolkit.
Let's be real. For every busy clinician, the clock is always ticking. When you're trying to accurately risk stratify a patient with localized prostate cancer, you're stuck manually cross-referencing all these complex guidelines, and that's time you just don't have.
So, this tool, it's built to solve that exact problem. It gives you an instant, totally streamlined and evidence-based risk assessment in seconds. Not hours, seconds. So you can move from diagnosis to a solid treatment plan with real confidence.
Okay, but before we jump into the demo, we have to talk about what's under the hood. It's absolutely crucial to understand the clinical engine this is built on. Because, this isn't just some simple calculator. It's a powerful, automated application of the evidence-based guidelines we all use. So, what's the fundamental clinical challenge here? It all comes down to triage. We've got to separate the indolent, clinically insignificant tumors, the ones that are perfect candidates for active surveillance, from the really aggressive disease that threatens survival and demands definitive treatment. Getting that one decision right, well, that's everything. And as you can see right here, this master calculator is designed to do just that by integrating 3 essential evidence-based tools. It automates the NCCN risk stratification, the CAPRA score, and the Epstein criteria to give you this comprehensive risk profile. So let's break down what each one of these brings to the table.
All right, first up, the NCCN guidelines. This is the big one, right? It's the current standard of care. It's that hierarchical system we all have to use to assign a patient to a risk group, which then points us directly to the right treatment recommendation.
And this table, it just perfectly shows the complexity we're dealing with. Just look at the criteria for, say, unfavorable intermediate risk. It can be triggered by multiple factors, right? A specific grade group or maybe a high volume of cancer in the cores. Trying to navigate this intricate decision tree for every single patient, that's exactly the time suck this tool automates.
And here, in this reference table, you see the payoff. Each one of those NCCN risk groups, from very low all the way up to very high, maps directly to a specific management pathway. This is how we translate a risk score into a real, concrete clinical action, whether that's active surveillance or jumping into aggressive multimodal treatment.
Okay, now let's add another layer of detail with the CAPRA score from UCSF. This is a really cool, validated 0 to 10-point system, and it has a very specific job. It predicts the 5-year probability of biochemical recurrence-free survival. In other words, the chances the cancer doesn't come back based on PSA levels, specifically after a patient has had a prostatectomy. And this chart right here, it just visualizes the incredible prognostic power of this score. Look at the difference. A low CAPRA score, that patient has about a 91% chance of being recurrence-free at 5 years. But a high-risk score? Wow, that probability just plummets to 56%. This gives us that much more granular detail that really complements the broader NCCN categories. And finally, we have the Epstein criteria. The best way to think about this is as a really specific filter. It has one job and one job only: to identify patients with those clinically insignificant tumors, the ones who are absolutely perfect candidates for active surveillance. It's like a final check for that low-volume, indolent disease. Now, the key thing to remember here, and this is crucial, is that a patient has to meet all of these strict criteria. It's not a most of them situation. If even one of these boxes isn't checked, let's say they have more than 50% cancer in just one core. Boom, they fail the criteria. Simple as that.
Okay, so that's the foundational science. We've got the NCCN, CAPRA, and Epstein criteria down. Now, let's see how Onco Toolkit puts all of this into practice and does it instantly and with total transparency.
So here we are on the input screen. It's super straightforward. All the key patient data goes right into this one clean interface. You've got age, PSA, prostate volume, clinical T-stage, the Gleason patterns, and all the biopsy core details. No more hunting through different charts or PDFs. And then, with just one click, bam! The tool calculates everything, all at once. For this particular patient, the result is crystal clear. NCCN unfavorable intermediate risk, a CAPRA score of 4, and, importantly, the Epstein criteria are not met. This comprehensive profile tells you, instantly, that this patient is not a candidate for active surveillance. They're going to need definitive treatment.
But how did it arrive at that conclusion? This is really important. We don't believe in black boxes. The math and the reference tables are right here for your review. It's all about building clinical trust through complete and total transparency.
And let me show you what I mean. If you look at the formula logic section, which is right there on the clinical background page, you can see the exact logic trace. It shows you the hierarchical steps for the NCCN score, the point-by-point summation for CAPRA, and that simple binary pass-fail check for Epstein. The entire calculation is laid bare, right there for your clinical validation.
Okay, now let's shift gears a little bit, because this tool isn't just about making point-of-care decisions. It's also an incredibly powerful engine for your academic research. So let's jump back to that results screen for a second. See that Export All to CSV button? With a single click, every single patient you've run through the calculator becomes a neat row in a research-ready dataset. This right here, this is the bridge from your individual clinical work to powerful cohort-level analysis.
What this does is create a seamless clinic-to-publication workflow. Think about it. Step 1, you calculate the risk scores for your patients. Step 2, you export the whole cohort. Step 3, you use the Polisher tool to clean up the data. And Step 4, you're generating publication-ready survival curves for your next paper. It's that streamlined. And here's a look at how that ecosystem actually works. On the left, you've got the CSV Polisher. It handles all that tedious data cleaning, missing values, formatting issues. It gets your data perfectly prepped for a clean import right into the survival analysis tool, which you see on the right. And that's where you can generate your Kaplan-Meier curves and calculate hazard ratios for your research. So let's just recap. This platform takes you all the way from a complex clinical question at the bedside to a fully analyzed data set that's ready for publication. Your next big research project? It literally starts right here. So the only question left is, are you ready to analyze your cohort?